Story 1. Iron levels were so low that they caused heart palpitations and a feeling of panic. I was entering cardiac complications territory, and no one flagged it because my other blood values were only slightly low. Story 2. Perimenopause. Toxic work environment. Burnout. I left the job. Found a better one. Started hormone replacement therapy. No more anxiety. Story 3. Faulty pancreas. Took 30 years to diagnose. 30 years lost to pain, migraines, and bowel problems. A random ocular migraine led to a neurologist suggesting low-dose medication. Suddenly, getting healthy at 55 has been a strange journey. Story 4. Ulcerative colitis. Thankfully, it has not progressed significantly. My stress and anxiety, along with a poor diet caused by mental illness, were harming me from the inside without my awareness for years. Story 5. Cancer. I had anxiety and tinnitus for months, not knowing why. My laboratory tests looked good. They thought I had anxiety. Then came the cancer diagnosis during an emergency visit. After treatment, surgery, and chemotherapy, the anxiety went away. The tinnitus went away. Of course, new anxiety emerged because cancer is scary, but it was not the daily intense anxiety I had felt before. My anxiety was a cancer symptom that led me to discover the truth that I had cancer. Story 6. Lactose intolerance. My mother used to take me to the doctors as a child because I was sick every morning before school. The doctor thought I was being bullied and had anxiety about attending school. However, my morning breakfast cereal was making me ill. Story 7. Iron deficiency anemia and low vitamin D for over 20 years. I was also told I was hysterical because of hormones. Guess my physical gender. Shaking my head. Story 8. Not me but my sister. A dermoid ovarian cyst that reappeared in the ultrasound. She needed surgery. She is fine though, so it is okay. Story 9. Not me. Friend. Hypertrophic cardiomyopathy. Likely experiencing episodes of ventricular tachycardia. He managed his palpitations until they resolved. He died in his sleep. The diagnosis was made post-mortem. Story 10. Gallbladder infection and severe stones. Bipolar disorder. Recently, a very bad chest infection. No ma'am, I can't breathe because my lungs are full of pus. Not because I'm nervous. I know the difference between being sick and having anxiety. I have dealt with anxiety for 2 decades, and I understand what it feels like. Story 11. Narcolepsy, specifically type 2 without cataplexy, is harder to recognize and diagnose. Receiving treatment enabled me to sleep, and suddenly my anxiety improved significantly when I was no longer chronically sleep-deprived. Story 12. Celiac disease. I vomited violently every single day for over 10 years and saw countless doctors and specialists. Everyone except my current doctor dismissed it. Most said anxiety, and one, I swear to all things sacred and profane, said something to the effect of, "Since you're overweight, is that really so bad?" Referring to the frequency of my sickness. Is my anxiety an issue? Sure, I am a woman living in the year 2025, of course. But also, maybe the fact that the comfort food I turned to was essentially destroying my body in multiple ways. Story 13. Attention deficit hyperactivity disorder and complex post-traumatic stress disorder. The National Health Service assumes almost every mental health problem is anxiety and depression and quickly prescribes selective serotonin reuptake inhibitors and cognitive behavioral therapy as a result. This approach is lazy and dangerous. I had been clearly describing the symptoms of both conditions for a decade before giving up and seeking private care. I am much less anxious since treating the conditions I actually have rather than just the symptoms. Story 14. I was having horrific leg cramps that would come and go. I was at work in a group home and could not leave unless someone came to relieve me. I called my manager, panicking. I should not have even been there because I was sick with the flu and a stomach virus, but I was a pushover back then and came anyway when begged to. My manager said he was on his way and that he called an ambulance for me. I am certain he told them I was either faking or just having a panic attack because that is what they said I probably had, since the pain had temporarily subsided. They hesitated and said they could take me to the hospital if I really wanted them to and were very dismissive. It made me feel crazy, and when my manager arrived, I somehow managed to drive myself home. If I had not gone to the emergency room a few hours later, I might have had irreparable damage because, after not being able to keep even water down due to illness, I had deliriously taken almost a whole bottle of antacid tablets and overdosed on calcium. The unbearable pain in my legs was basically potassium cramps intensified because the calcium disrupted my entire system. It did not help that I still had the flu and pneumonia. All in all, I was in the hospital for a week and could barely walk for another month. My manager would have still argued it was not that bad if I had told him the pain was so severe that they gave me strong pain medication, which is not something they administer lightly. Story 15. My mom had cancer. She kept experiencing knee pain and went to a doctor who said it was anxiety. She visited a different doctor who ordered an X-ray. Within a week, she had surgery. Story 16. Pseudotumor cerebri, also known as idiopathic intracranial hypertension. I have had symptoms since I was about 15, and my primary care doctor wanted to prescribe me Xanax for anxiety. Finally, in 2019, when I was 24, I was desperate because I was feeling very unwell. I begged an emergency room doctor to take me seriously, as I knew something was wrong. A head CT scan showed an abnormal amount of fluid around my frontal lobe area. I was referred to a neurologist for an MRI. The neurologist said it was just anxiety. I pleaded and insisted that I was not imagining things, and she gave me a referral to a neurosurgeon. Finally, the neurosurgeon listened to me and said he thought I had pseudotumor cerebri. Additionally, he found a small aneurysm on my MRI scan. He referred me to a vascular neurosurgeon who performed a spinal tap and a cerebral angiogram. Those tests confirmed that I have pseudotumor cerebri due to narrowing of the ventricles in my brain, and that I have a small aneurysm that does not need to be clipped at this time. All those times people called me a hypochondriac or someone who thinks a headache is a brain tumor, I did have a real condition that makes my body react as if I had a brain tumor. Story 17. Iron deficiency anemia. I was developing a rash on my face every day, feeling lightheaded constantly, and was told I was just anxious and stressed. Story 18. Anxiety about the pain caused by an undiagnosed ear infection. 1 year, 2 rounds of physical therapy, 10 visits to the psychotherapist, and 1 10-day course of amoxicillin later, the musculoskeletal pain caused by anxiety in my neck is almost gone all at once. I felt like I was dying. I thought I might have neck cancer. The physical therapy was still necessary, and we are working on the completely other side of my body now, but that ear infection did not show itself until I was already on antibiotics. Story 19. Atrioventricular nodal reentry tachycardia. I would get sudden spikes in heart rate that generally lasted from 10 seconds to a few minutes and resolved on their own. I would feel anxious, need to walk and pace, and feel tired afterward. Because the episodes were so short, there was no clear way to diagnose anything, so most doctors I saw said it sounded like a panic attack or generalized anxiety. It was not until I had an episode that lasted over an hour and had to be given adenosine that I received a real diagnosis. I had an ablation about 12 years ago, but it has returned over the last year, so I now need to have another. Story 20. It turned out to be crippling obsessive-compulsive disorder that hit me like a train when I turned 25. I am doing better now, but I lost my early 20s to compulsions and intrusive thoughts that almost drove me to self-deletion. If you are struggling with severe anxious thoughts about specific topics, feel compelled to act to stop the thoughts, or develop intrusive rituals to self-soothe, please get evaluated. Story 21. During chemotherapy years ago, they put the medication into a vein that burned at the top of my arm. They told me it was fine and that I was just anxious. A social worker came to help me relax by teaching mindfulness, but it didn't stop the burning. It didn't take long before the drip stopped on its own and had to be repositioned. This time, someone else inserted it, and it did not hurt. Story 22. Asthma. I had an upper respiratory tract infection that reactivated my childhood asthma. I kept describing to doctors how I would wake up in the night with a horrible dry cough and difficulty breathing. After 2 visits to the clinic and being told it was just anxiety and that I should focus on calm, deep breaths and take breaks from work, I finally went to the emergency room. Despite all the deep breaths I was trying to do, it felt like I was breathing through a straw, I was seeing black, and my lips were blue. I received some steroids and I recovered quickly. Now, I see a lung specialist regularly and take a daily inhaler. Story 23. Congenital heart defect. It took a full angiography to find it, and the cardiologist said, "Well, it probably will not kill you," and put me on beta blockers for life. My occasional panic attacks became daily for a while. Then my wife said, "I know this is scary, but you are still here." So I started going to the gym and working out harder and harder with the idea that at least there is a defibrillator there. I am still here, and now when I get the weird pause or thump heart palpitations, I just ride them out, knowing that they really are basically nothing. Story 24. Sepsis after long coronavirus disease. My mother and father both died of coronavirus disease. My sister was hospitalized for 31 days and ventilated with it. I guess they thought I was being hysterical and over-exaggerating my symptoms, or because of the questions I asked and the few complaints I made about feeling very unwell for so long. Story 25. Not quite, but related, I was told by 2 different doctors that my multiple sclerosis was nothing to worry about. Story 26. Autism and attention deficit hyperactivity disorder. Such a winning combination. Every task is done, just not the ones you were supposed to focus on. Story 27. Ehlers-Danlos syndromes are a group of rare disorders that affect the body's connective tissues. Connective tissues provide support and structure to the skin, bones, blood vessels, and organs. People with Ehlers-Danlos syndromes often have very flexible joints, stretchy and fragile skin, and may experience chronic pain and other complications. Story 28. Idiopathic intracranial hypertension, also known as pseudotumor cerebri. I almost went blind because multiple doctors told me it was anxiety, and then I was finally diagnosed by an eye specialist. Story 29. Sarcoidosis. My father had recently died, and the general practitioner completely dismissed my physical symptoms as a grief and anxiety response. Story 30. Just is an offensive word. Anxiety is more common than depression, and naming an emotion is not insulting at all. As long as anxiety exists for the person suffering, further consultation with a mental health professional is the best way to determine which, if any, anxiety disorder is most likely. If it is not an anxiety disorder, there are an almost infinite number of mental health diagnoses of which anxiety is a symptom. If a person is in emotional distress, stating that any mood is just a mood suggests that the person with poor communication skills will actually suffer more in the long run due to their own ignorance and willingness to trivialize a well-known and crippling emotion that needs to be addressed more and judged less. Excuse my poor communication at the moment. I am suffering in an unprecedented situation, and I wish someone would tell me I am just anxious. I will give them first-hand experience of major anxiety with pleasure. Story 31. After I was told my knee did not actually sublux and that since it did not hurt when it happened, there was nothing to see, my husband spoke up for me. Only then did they check the looseness of both my knees and give me a brace. I could not walk because it was so unstable. Only the rheumatologist took me seriously. Story 32. What I had naively described as my heart pounding like mad were 2 signs of low iron. Pulsatile tinnitus, a rhythmic thumping in your ears instead of the usual high-pitched tinnitus, and internal tremors which made my internal organs twitch. Of course, I figured it out on my own. What are doctors even for? Sigh. Story 33. Vertigo that manifests as seizures. I have anxiety, but the medications do not work for my anxiety. However, they usually keep the seizures away. Story 34. Perimenopause and a major job change caused anxiety, which was worsened by perimenopause, resulting in palpitations and insomnia. Story 35. I was told I was having a panic attack. I was actually close to experiencing full respiratory failure due to an asthma attack. Story 36. The methylene tetrahydrofolate reductase gene mutation causes a significant neurotransmitter bottleneck. All I really needed was folinic acid to bypass the bottlenecks. Story 37. Stress-induced psychosis. You were just a bit anxious about school or tests. When did anxiety include hearing voices? Story 38. Pelvic congestion syndrome took years to diagnose. I could have died in seconds from any abdominal trauma. My insurance did not approve it, so I have to pay out of pocket. Story 39. complex post-traumatic stress disorder, and autism. My parents had a vested interest in me not understanding my brain because they caused most of the post-traumatic stress disorder, but doctors should have investigated more thoroughly. An 8-year-old suicidal child is not normal. Story 40, Epilepsy. I was having intense auras, but they could not find anything on a magnetic resonance imaging scan or electroencephalogram, so they diagnosed me with anxiety and recommended group therapy. I was experiencing phantom smells and partial hallucinations, and I was adamant it was not just anxiety. About 6 months later, I had a full-blown tonic-clonic seizure and was finally put on medication. It has been 5 years seizure and aura-free. Story 41. Always a good excuse to share the best description of anxiety I have ever heard. You know that feeling when you're driving in the winter and your car hits ice? That horrible lurch of fear when the car starts to slide? Imagine that feeling, but instead of lasting a few seconds, it is there constantly for days and weeks on end. That is anxiety. Story 42. Ehlers-Danlos syndrome, postural orthostatic tachycardia syndrome, malformed blood vessels in my brain, and most recently a retrolisthesis in my back. The list keeps growing. Story 43. Epilepsy. I was 23 and told my doctor I was having strange twitches when speaking in public. I shrugged it off as anxiety. It turned out to be a trigger. I finally had a generalized tonic-clonic seizure while conducting training and was properly diagnosed after dealing with seizures for 3 more years. Story 44. Anxiety. Weekly therapy and some maintenance medications absolutely saved my life. I live a much healthier life now because I took action and got help. Story 45. Not me, but my wife was told that she had supraventricular tachycardia and ended up having surgery. Story 46. More sugar than I had calculated due to the overconsumption of a favorite food whose ingredient label I had misread. I also do not have as much short-burn frantic energy as I thought. Story 47. It felt like I was always sick as a child and frequently sick as a young adult. My symptoms were runny nose, congestion, cough, earaches, sore throat, and fatigue, but never fever. I had multiple ear infections and sinus infections diagnosed and treated by my pediatrician. However, my temperature was always 98.6 degrees Fahrenheit or lower during sick visits. Many times I just never went to the doctor and did my best to manage cold, flu, and allergy symptoms on my own. The lack of fever led almost every medical professional, teacher, relative, boss, or colleague I encountered to initially think I was malingering or overly worried about my health. I was also told many times my symptoms were a result of seasonal allergies and should be treated with over-the-counter medications and rest. They believed it couldn't be that bad because I didn't have a high temperature. One time in middle school, I had the worst sore throat I had ever experienced. I described the feeling as having a bottle cap jammed into my soft palate. The school nurse told me to drink more water and called my mom to inform her that I was being sent back to class because my temperature was only 99.9 degrees Fahrenheit. Since I never ran a fever, my mother decided to pick me up and take me to the doctor, where it was determined I had scarlet fever. Another time in college, I woke up with a swollen nose. It burned and ached. It felt like I had been punched in the face or swam in a highly chlorinated pool. It was alarming, so I had it checked out at school. Again, I had no fever, but after being questioned about the possibility of this being a sexually transmitted disease, which was impossible, or a drunken injury, which was unlikely in this instance, they finally treated it like an infection and gave me antibiotics, which thankfully cleared it up. Then, in my late 20s, I got really sick. I had a cough, an earache, and was exhausted. I worked as a paraprofessional and had never taken a sick day, but when I needed to take 2, I had to go to the doctor, even though I was not running a fever. They looked at me like I was overreacting for coming in with cold or allergy symptoms, especially when my temperature read only 99.9 degrees Fahrenheit. Turned out I had pneumonia and a double ear infection. It was not until I was 30 years old and had my 3rd sinus infection of the year that my primary care provider decided I should see an ear, nose, and throat specialist. After hearing my history, the specialist ran blood work that determined I had an immune deficiency making me susceptible to certain types of bacteria, as I do not make antibodies for them. It turns out that many people with immune deficiency have a diminished fever response, as I seem to have. I had been told my whole life that I couldn't be that sick or it was all in my head. When I learned there was an actual reason I felt so bad so often, I felt vindicated and validated. Story 48. Gallstones took 20 years to get a correct diagnosis, which I did myself once the internet became widely available. Story 49. A heart condition was causing me severe anxiety, which then worsened my heart condition, creating a vicious cycle. Story 50. A congenital heart defect required surgery. Most people have it identified and fixed in their teenage years. I was 35 because it was thought to be anxiety. Story 51. Carbohydrates fueled my chronic generalized anxiety all my life. It was not until I finally gave up carbohydrates and sugar that it disappeared. Story 52. My friend recently went to the hospital emergency department with pain and distress in her chest. Most doctors told her that she was just stressed. One doctor advocated for tests. The gallbladder was necrotic and infected. After gallbladder removal surgery, she is okay. Story 53. Gallbladder failure and irritable bowel syndrome with diarrhea. I was waking up in the middle of the night with pain, night sweats, and awful dreams. I could barely eat. I spent about 6 months living on tuna fish and crackers. The first few doctors I saw said it was anxiety and recommended seeing a therapist. I kept pushing because something felt wrong inside my body. I finally got a referral to a gastroenterologist and had many tests done. Removing my gallbladder stopped all the problems I had at night. Changing my diet helped my irritable bowel syndrome. Story 54. Stage 4 lung cancer and pneumonia. My mother was still doing factory work at only 60. She was told several times that she had anxiety. She died 2 weeks later. Story 55. Oh, I had a spontaneous coronary artery dissection that led to a heart attack. When I went to the emergency room, one doctor said it might just be anxiety. I cannot fault him. It is Occam's razor. I said respectfully, it is not a panic attack. They took me seriously, and after a couple more tests, only my troponin levels were very high with no blockages showing on imaging. 20 minutes later, I was in the catheterization lab getting stents placed. Story 56. Primary hyperparathyroidism. Causes anxiety in the body. I first knew something was really wrong when I was happily relaxed, snuggling with my husband watching a movie, and suddenly my body would flood with anxiety completely out of nowhere. It has taken me many years to finally get diagnosed, followed by another 2-year wait for surgery. In just 2 days, I will have the operation that should fix it. Yay! Story 57. Post-traumatic stress disorder. The army told me to buck up and walk it off. At least I was still alive, even if others were not, which was the cause of the anxiety to begin with. Story 58. Wolff-Parkinson-White syndrome. My heart was racing so fast I was passing out. I went to the emergency room 3 times with heart rates of 170 while just lying in bed. But they sent me home each time for having a panic attack and anxiety. Of course, I was anxious. I thought my heart was going to burst. I went to an emergency room an hour away the next time it happened, received the shocking diagnosis, and had surgery the following week. Story 59. I was experiencing heart symptoms and was told it was just anxiety for a month, going in and out of urgent care and the emergency room the whole time, until they finally performed additional tests and diagnosed paramyocarditis. I had been experiencing ventricular tachycardia, shortness of breath, and chest tightness for much longer before I was taken seriously and admitted to the hospital immediately. Story 60. Endometriosis. It might have been a flare-up from anxiety, but it is still a physical problem in my uterus. I now have better medication and I am doing very well. Story 61. The fear of social interactions developed. When I was around 11 or 12 years old, I started vomiting constantly because the time I was having at school made me very anxious. My doctor said it was just anxiety and that I did not need to stay home afterward. My school usually had a rule requiring students to stay home for 48 hours in case the illness was contagious. In the following years, I did not leave my house and stopped attending school. Story 62. Vitamin D deficiency and my first rib had been pushed upwards due to an incident years ago, causing nerves and blood vessels to be compressed. After physical therapy helped reposition the first rib, it was much easier to feel calm. Now I have to deal with painful rehabilitation after years of my body adapting to the wrong position. Story 63, Heart Disease. Are doctors becoming less knowledgeable or less caring? I do not know. I worry that the standards for medicine have dropped significantly in my state. Story 64. Just want to say thank you for this thread to everyone who has contributed, to everyone who has shared their stories. It is both a relief to know we are not alone and anxiety-inducing because now I have a few new black holes to look up on WebMD. But yes, thank you. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.